Watch this before you have meniscus surgery. This patient had a medial meniscus tear and underwent a surgery called a meniscectomy, where part of the damaged meniscus is trimmed or removed. Unfortunately, this patient had zero relief after this meniscus surgery, and over the next several years, her pain actually got much worse. She struggled with pain on a daily basis, especially at work, which required a lot of walking. At the end of the day, her knee would be very sore, and she couldn't tolerate it anymore. Her new knee MRI showed that the knee had gotten significantly worse. There was very little meniscus left, and what was left was being pushed out of the joint. You can also see here that the cartilage was severely worn down. After reviewing her options, we ultimately decided on doing bone marrow stem cells for her knee. I injected into the meniscus, the MCL, the joint space itself, but most importantly, into the bone. Here's the setup from the procedure, and here's the injection of the stem cells into the bone. At her 3-month follow-up, the patient told me she was pain-free with walking and only had some very mild soreness at the end of a busy workday. This original meniscus tear could have been handled well with just a PRP injection, but after a failed meniscus surgery, allowing for significant wear of the knee over the years, she ended up requiring stem cells in order to avoid a knee replacement. So before you have your meniscus cleaned up, please understand that there are consequences to taking out your meniscus, and there's other options besides surgery.